I'll get started while they fix that. Yeah, it's very hard to talk about another doctor after Zahrawi, who's obviously has a large footprint. I'd like to make... This is the next one? Is this it? Okay. I'd like to sort of make two interventions in the conference. Well, the first one, before making the interventions, they're suggesting was to thank the organizers for the invitation and for the wonderful arrangements. The first intervention I think I'd like to make is we've been focusing on the golden age, and I'd like to urge students and colleagues to think more about not skipping over the colonial period. The colonial period is not just a period of decline, but it's a period in which we have engagement of engaging in resisting colonial powers, and it's essential to understanding where medicine is at today. So the story I'm going to be telling about Dr. Naguib Mahfouz, who, to get to the chase, delivered the author, Naguib Mahfouz, who is named after him. That's part of the story. Is part of this colonial story. The other intervention I think I'd like to make is to suggest that we bring patients into our stories. I'm a social historian by training, not someone who came out of history of medicine. So this is the technique. In 1902, when he was still in medical school, Dr. Naguib Mahfouz, who was born in 1882 and died in 1974, was sent to Alexandria, where one evening Dr. Shukri, assistant director of the government hospital, asked him to come to his private clinic to assist in a difficult labor. Shukri had tried unsuccessfully to deliver the baby with forceps and without anesthesia, but the baby would not budge. He asked Mahfouz, who had thin arms and hands, to try to bring a foot through the cervix, but Mahfouz, who had never seen a difficult delivery labor, let alone a normal one, declined. Mahfouz gave the patient anesthesia and reassured her, and the doctor and his assistant attempted to pull the fetus down for 2 hours. The body came out, but in the process, its head was severed and remained in the uterus. When Mahfouz suggested that they call in an obstetric surgeon or take the patient to a government hospital, Shukri told him that there was no foreign or Egyptian obstetrician in Alexandria. After subsequently learning that the woman died overnight, images from the incident haunted Mahfouz, who writes in his memoirs that from that moment he decided to do everything in his power to study obstetrics and gynecology and to dedicate his life to helping women suffering from difficult labor. After taking his exams, Mahfouz established an outpatient clinic for obstetrical and gynecological patients at Asr al-Aini, the government hospital in Cairo attached to the School of Medicine. He delivered thousands of babies in normal and difficult deliveries in government and private hospitals and homes, performed numerous surgeries, pioneering several techniques, most notably on fistulas. His reputation as the father of obstetrics and gynecology in Egypt spread, and he lectured widely in Europe. But by the time of his death in 1974, Mahfouz had received the highest honors of the field in Egypt and abroad. He became an honorary fellow at the Royal College of Surgeons and the Royal College of Medicine in Great Britain, and he became a corresponding fellow with the New York Academy of Medicine. And as I come from New York, I show you a sculpture that's outside of a statue. Had Mahfouz visited New York, he might have seen the statue of Dr. James Marion Sims, who some of you may know as the father of modern gynecology. Mahfouz acknowledged Sims' role in developing a cure for vesicovaginal fistulas, but probably did not know that Sims had honed his surgical skills by practicing for 4 years, 1845 to 1849, without anesthetics on 3 enslaved black women, Anarcha, Betsy, and Lucy, whom he had leased or had bought and put in a hospital started on a plantation in Alabama. Essentially, he conducted 40 operations on the 3 women until he had, it was an experiment, until he had perfected technique. That story about these women is often left out of the story of his rise to the top of the profession. We heard he was lauded as the founder of New York's first women's hospital and of a field. So he's recently, you can see it here, in the debates that ensued last year, the statue was actually removed off the pedestal because of the politics around Civil War statues or Civil War era statues in the United States. Mahfouz was no Sims. He has never been accused of operating on women without their consent. To the contrary, he is known to have gone out of his way for his patients, treating them with great care, respect, and sensitivity. I would like to use Mahfouz's story to consider his relationship to his patients, to restore women to the story of the origins of gynecology and obstetrics in colonial Egypt, and to sketch the history of childbirth and maternal health there. From the early 1900s through the 1960s, and Mahfouz lived even a little longer than Sahrawi. He was 92 at his death. He authored a large number of scholarly articles in Arabic and English. He wrote a history of medical education in Egypt. He wrote textbooks. He also collected specimens for teaching students about anatomy and disease, which in turn became the core of a museum. He also wrote memoirs both in English and Arabic. The fathers of modern obstetrics and gynecology, whether loving or abusive, built their careers and reputations on the backs, or better yet, the wombs of women. So I'm kind of asking, does the patient speak? Can the patient speak? I would like to start by returning to the nameless woman lying on the table in Alexandria in fall 1902. Why did she labor so long without an anesthesia and a specialist? Why were there no obstetricians in Alexandria, Egypt's second largest city, in 1902, 20 years into the British occupation? Mahfouz tells the story of his own mother's labor in his own birth in the Delta town of Mansoura in the winter of 1882. His mother, who was 45 at the time, had already bore 7 children. She labored for 3 days, attended by a doctor and a midwife. The midwife, thinking that the baby was stillborn, placed it along with the placenta on a copper tray near an open window. Half an hour later, an aunt noticed that the baby was breathing feebly. The midwife wrapped him up, cut the umbilical cord, and resuscitated him. Mahfouz was a precocious child who decided at an early age that he wanted to study at the School of Medicine. Arriving at the School of Medicine in Cairo, and this was Asr al-Aini, had been started in 1828 under Cloyd Bey, a project of Mehmet Ali. Mahfouz arrived in 1898 to begin his course of training, just as the British made English language instruction mandatory. So previous to that, the instruction had been in Arabic, but from 1898, instruction was in English. What that meant was that it led to the appointment of British instructors in place of Egyptian medical men. And the students, and particularly in certain fields, particularly in the field of obstetrics, had few lectures and no clinical training. Asr al-Aini had recently started wards for women that were superintended by English nurses, but no beds for maternity patients, no section of gynecology or obstetrics in the hospital, and no outpatient clinic. When it came to sexual and reproductive health, the only government hospitals dedicated to women were sort of so-called lock hospitals. These were specialized facilities that the British had set aside early on for female patients with venereal diseases, who were literally locked up until they were cured. British health officials in Egypt were much more concerned with infectious diseases like syphilis and gonorrhea that could spread to members of the British Army than to women's health, difficult labors, and maternal mortality, which was relatively high. In 1904, after graduation and a short stint in Suez Hospital as a medical officer, Mahfouz returned to Asr al-Aini as an anesthetist. He proposed to his former teachers that he be allowed to start a gynecology outpatient section before his work in surgery. A sample trial was set up. The British actually doubted that Egyptian men would allow Egyptian women to attend the outpatient clinic, but Mahfouz writes, the result was more encouraging than I had ever anticipated. In spite of the hesitation of the British staff, Egyptian women came in numbers. This led to the reservation of 10 beds in the hospital, with Mahfouz attached to the surgical department as an assistant and assigned all the obstetrical cases. Mahfouz points out that the number of cesarean sections was approximately 5 a year. This operation was always done as a last resort in cases of severe contraction of pelvis, admitted to hospital after fruitless attempts at delivery outside it. I say that that's interesting to me because in the United States now, cesareans are at a rate of like 30 to 40%. So Mahfouz would not have approved of such a high rate. Due to the demands of the outpatient work and its success, the hospital director authorized Mahfouz to relinquish his work as an anesthetist in order to focus on obstetrics and gynecology and teaching. Mahfouz asked to go abroad to study gynecology and visit maternity hospitals, but the British director wouldn't allow him to. Instead, what he did is he brought a British expert, that's Mahfouz, brought this British expert, Dr. Roy Dubin, who had worked in the Rotunda Hospital in Dublin, Ireland, and had read an article of Mahfouz's in The Lancet. So Dobin was, or for a long time, Mahfouz would serve as an assistant to Dobin. Since the number of hospital beds for obstetrics and gynecology was limited, Mahfouz made an arrangement with the Department of Public Health, medical officers that they call him, to attend to difficult cases in patients' homes. Over the next 15 years, he attended some 2,000 cases. He accepted no money for these cases. He was a genuine sort of scholar and doctor who wanted to learn and just keep on improving. And he tells stories of few nights at home, most nights on the road, delivering babies. In December 1911, a couple called him in. They were so appreciative of his services in delivering a child in a hard labor that they named the child Naguib Mahfouz. So the author Naguib Mahfouz, who went on to win the Nobel Prize in Literature, was actually named after Dr. Naguib Mahfouz. At the same time, Mahfouz began performing special operations in the hospital and developing his own techniques. Okay. While elite women turned to the private care of an obstetrician or professionally trained midwife, most Egyptian women had their babies delivered by a daya or village midwife. Public health officials began to pay greater attention to these women who delivered babies when they realized that they were key to educating mothers about hygiene. And also were key to lowering extremely high rates, some 70%, a 70% infant mortality rate. Again, this was another area where the British showed little concern with bringing down infant mortality rates. But public health officials and reformers and doctors began thinking about the training and licensings of dayas and midwives. The Department of Public Health waged war on the obstetric chair, seeking to displace it with more modern positions in childbirth, but the chair remained a fixture of Egyptian births. Officials called repeatedly for the establishment of a maternity hospital and training school in Cairo. A part of the problem in training maternity cases was the dearth of beds for maternity cases, particularly in Cairo. The First World War gave Mahfouz the opportunity to begin to address this problem, and you can just see this pattern. I mean, this man worked very methodically, very slowly, very cautiously to simply transform the way medicine, maternity medicine was taught and practiced in Egypt. So during the First World War and its aftermath, Mahfouz got the opportunity to address the problem. In March 1919, in the midst of the 1919 revolution, when the British director of the hospital resigned, and in the absence of Dobin, who was on leave, Mahfouz was able to push forward a scheme of finally getting a maternity ward in the hospital. They basically built it on the ground floor of what was formerly the Lady Cromer Home for Orphans. The ground floor became outpatient clinic. The first floor was a maternity ward, and the second was reserved for the foundlings. It took another 10 years to start training women doctors, when 5 female Egyptians were sent abroad for training in medicine, and 6 entered the Egyptian University Medical School. All were on government scholarships and expected to work in government jobs. And Mahfouz was very supportive of these first women doctors. They're not exactly the first women doctors in the 1840s. Women were trained as doctors, but it's sort of complicated. These were the first women licensed in the way that the male doctors were being licensed. So Mahfouz the hospital's really finally set up in a way that Mahfouz can begin to really perform more surgeries and cater to more women who have difficult deliveries and other gynecological problems. In 1908, to go back a bit, a woman who hailed from Upper Egypt had a prolonged labor, after which she developed a urinary fistula. So I'm now turning to Mahfouz's surgery. Such a condition, in which urine leaks from the bladder into the vagina, creating an awful smell and irritation, was not uncommon amongst Egyptian women in Egypt at the time. The high incidence was ascribed to prolonged labor, lasting upwards of 3 to 4 days, marriages consummated with young girls, as well as deliveries in which medical instruments tore women's tissues. And the reason why we don't hear about this so much, hear about this in Egypt today is because of Mahfouz. But the woman from Upper Egypt had 3 unsuccessful operations at the government hospital to correct the fistula, after which the surgeon advised her to go to Asr al-Aini to see Mahfouz. She basically walked from Upper Egypt. She got as far as Minya, had another operation, and then, which was also unsuccessful, and then continued to walk to Asr al-Aini, where Mahfouz, who was scheduled to go abroad finally to take his sort of tour of Europe and have the opportunity to see some of the surgeons practice and go to medical museums and so on, delayed his trip. Which also reflects on what kind of man Mahfouz was. And he delayed the trip, operated on the woman, who regained the use of her bladder. From the beginning of his career, he was interested in the academic research side of medicine. He read widely, presented papers. Presented papers at national and international conferences, and published extensively. Some of his earliest research was on cesarean section. He also maintained his interest in pioneering use of spinal stovane, and warned against the use of piturin. Mahfouz operated at Asr al-Aini, but also saw patients and operated at Kitchener's Memorial Hospital and the Coptic Hospital. So it's not enough to be a doctor, one also had to be instrumental in founding hospitals and building the institutions that the doctors could practice in. Most of his early articles were published in Al-Majalla al-Tabiyya al-Masriya. Later on, he published more extensively in the Journal of Obstetrics and Gynecology of the British Empire. Here we see just a scene from the operations. So these pictures that I show are from his atlas that I'll come back to discuss in a minute. Different things. Yeah. A few things become evident when reading through Mahfouz's accounts of surgery. One is that the women upon whom he operated were not silenced. In contrast to the slave women upon whom Sims honed his skills, Mahfouz's patients often found their voice. In 1918, Mahfouz reported on the use of spinal analgesia in a series of operations at Asr al-Aini. The stovane analgesia was greatly welcomed by our patients, he wrote in The Lancet. Most Egyptian women have a great dislike to general anesthesia. Many instances have occurred of patients refusing to have an operation done under chloroform, but agreeing to undergo the operation with stovane. Many women sought medical help because of sterility, which was sometimes caused by sometimes caused by a cyst. In operating on simple cyst, an attempt was made to leave behind any his approach was always a kind of conservative approach. So in operating on cysts, attempt was made to leave behind any ovarian tissue that was considered healthy. While he doubted that it would cure sterility, he recognized that there was a small chance that the patient might not only that might conceive, which happened occasionally after partial ovarian resection. In some cases, actually, the patient got their way rather than Mahfouz. When operating on benign, solid, and cystic tumors, only the ovary affected was removed. We were forced to do this course since the Egyptian women value the power of procreation as second only to life. This was in spite of the fact that he would have preferred, or the doctors would have preferred, to treat all solid tumors as malignant and remove the uterus and other ovary to avoid recurrence. So in his work, Mahfouz almost always took a conservative approach. When he saw doctors in Paris performing total hysterectomies for conditions in which conservative removal of the diseased part would have been sufficient, he raised questions. In ruptured uteruses which had multiple causes, Mahfouz did not do total hysterectomies, but rather subtotal hysterectomies. And he would follow the patients afterwards to see if they gave birth. Yet it is his work. Yeah, this is, sorry, okay. Yet it is his work on fistulas which really stood out. Mahfouz's first publication on fistulas appeared in 1929. One of two papers read before the International Congress in Cairo in 1928, celebrating 100 years of the Australiani Hospital. He gave summaries of the operations performed, and over time, the cure rates were going up and up. This is basically his technique for the surgeons in the room. And he does talk a lot about the sutures. The women upon whom he operated were girls with faces and names, or at least initials. HR, a well-built Sudanese girl about 12 years of age, was married 2 years ago. Menstruation has not yet appeared. 2 months after marriage, she experienced a sudden sharp pain during coitus, which was being attempted for the first time. Hemorrhage and passes of feces from the vagina followed. At the time, there was a strong push by Egyptian reformers to raise the age of marriage of girls to 16, in large part to eliminate the sorts of injuries that Mahfouz was treating. Medical evidence collected by Mahfouz and his colleagues played a role in getting the legislation passed. So this is also the social role that doctors have. Mahfouz reported that, his cure rate, towards the end of his life, he writes that the cure rate for the last 500 surgeries for fistulas was 100%. So Mahfouz gave clinical lectures to students in obstetrics and gynecology, and also lectured students in the School of Midwifery. He realized his students had no textbooks, so he actually wrote and published at his own expense 2 textbooks for the students in both medical schools and the School of Midwifery and nursing. He also, in the course of lecturing, realized that the School of Medicine had no, the pathological museum had no specimens to help him explaining diseases to the students. So he set about preparing them. Okay, so this is the medical museum itself. He bought jars and chemical solutions from abroad. He slowly built up a collection of 300 specimens, which eventually increased to some 3,000. These were stored in the pathology department and carried to lectures. They were also exhibited during the congresses. With the support of the administration, he built up the collection, which he eventually donated to the Faculty of Medicine at Cairo University. And the collection was put in a special room, which was called Mahfouz Obstetric and Gynecological Museum. So you see some pictures from it. And that's the view from the Museum of the Nile. In building up the collection, Mahfouz was in step with the practices of the time. he had seen such museums in like the Hunterian in London. Yet the museum was, these museums could be seen as an instrument of imperial power or a spectacle of empire, projecting British authority. But the museum was also, for Mahfouz and his colleagues, a teaching tool. So this is one of these cases of adaptation and appropriation of an imperial tool. The students, staff, and foreign doctors who visited the museum clearly valued the collection. So valued were the exhibits, and that in one instance, a rare specimen of ectopic pregnancy in the infundibulum end of the tube from one of the surgeries was stolen by a foreign visitor. There is no mention in Mahfouz's work of patients having a voice or say in the exhibiting of tumors and other malignancies or their stillborn babies for the medical community. This is an ethical question that I'm interested in pursuing. Most of the specimens probably came from Mahfouz's poorer patients, for Asr al-Aini was a public hospital, but some may have come from other clientele at the private hospitals where he practiced. In 1949, when the museum contained over 1,300 specimens, the 3 volumes of the Atlas of Mahfouz's Obstetrics and Gynecological Museum appeared to great acclaim. So this 3 volumes, his Atlas is this tremendous work in which he's basically a kind of textbook on gynecology and obstetrics. Mahfouz prefaced different sections with descriptions of the anatomy of the part and the pathology, and gave more extensive coverage of history, clinical features, and operation techniques. So he is competing with, or following the footsteps of Zahrawi. The catalog contained full-page drawings and paintings like the ones I had showed earlier, and photographs of specimens with short descriptions in 7 languages. Mahfouz worked closely with his grandsons, who are seen here, 2 of whom were doctors. They repaid him in a tribute of paying for the renovation of his museum, which literally, I think, within the last weeks or months, just reopened in Cairo. And wait a second. Where's the assistant? Sorry. This is supposed to, for me? I need the AV because this is supposed to play. Would you know what button I should press? Is there a button I should press here? Yeah, okay. There should be music too. Is there sound? Okay. Is there sound? The sound is very inspirational, so you have to hear it. have some modern heroes too, I guess. Thank you very much.
Thank you, Professor Baron.